This brief video explains the aims and methods of an exciting ongoing research project. Are you aware of any published research studies which compared clinical outcomes between McKenzie diplomats versus non-diplomats for patients with low back pain? If you cannot think of any, you are correct. A wise research axiom states, publish or perish. There is a strong need to investigate clinical outcomes generated by experts in MDT who have taken the time and costs to graduate from the McKenzie Institute's diploma program. Some of the following statements might reflect your experience.
I'm frustrated with research based on clinicians with insufficient MDT training that produced results that were far from impressive and do not match my clinical experience and outcomes.
There is no research demonstrating how much our diploma training really makes a difference to improve our patients' lives and outcomes.
Considering all the training time, energy, and finances required to become a diplomat, we need research to help support and justify our choice to become experts in MDT.
This situation needs to be approached. This is the title of the research project, and these are the authors. Our disclosures. The study will assess the effectiveness and the efficiency of physical therapists after graduating from MDT Diploma Program for managing patients with low back pain during real-time clinical practice compared to other physical therapists without diploma training. The vast majority of your patients will be eligible for the study. 140 invitation emails went to diplomats in clinical practice in the USA. We anticipate study data for a minimum of 1,000 patients with low back pain treated by at least 30 consenting diplomats over the next 1 to 2 years. Data for the comparative group will come from the photo database. Due to the large photo database that includes patients treated by many therapists from all US states with differing levels of education, we will assume that this group of clinicians represent the average physical therapist that provides, on average, a standard physical therapy management. Photo is the largest physical therapy outcome data repository in the US. It's positioned well to serve as our comparative outcome group. We will run a retrospective analysis of observational data using cross-sectional data matching with no alteration of routinely patient data collection process. Between April and June 2025, invitation emails were sent to US diplomats who are actively treating patients and have maintained latest MDT education initiatives. Diplomats who are interested in participating need to ask their clinic owner or supervisor for approval. Then, the clinic owner signs a site agreement form consenting to participate and sends the document to Daniel Deutscher at the University of Utah. Data will be collected for all consecutive patients with low back pain regardless if a patient is ineligible or drops out. Each participating diplomat is being asked to submit a minimum of 30 consecutive complete patient episodes during the study period. If a patient drops out, that patient will not be considered as one of the 30 patients requested, although data are submitted. If you are collecting outcomes using photo, the only requirement is to send us your photo ID number. If you are not using photo, a few paper and pencil documents will be required: a modified Oswestry Disability Index or MODI and a patient discharge survey for the following patient cases. If a patient is ineligible, submit the patient discharge survey. It takes only a few minutes to complete this form and to enter the relevant information. If a patient drops out, submit intake MODI and patient discharge survey. If a patient completed treatment, submit intake and discharge MODI and patient discharge survey. All patient data are de-identified and all documents submitted are encrypted with a number. There are no patient names on any documents in the study. The propensity score will be determined after controlling for baseline characteristics in each logistic regression model, with the dependent variable being the exposure to diplomat assessment. We will develop 3 separate models, one for each outcome: functional status, pain intensity, and number of treatment visits. Matching will be done on all available baseline patient variables. Sensitivity analyses will compare matching results to evaluate for successful matching. Item response theory and percentile score linking approaches will be used to scale scores derived from either the modified ODI or the photo-LCAT on a common metric to allow for comparable outcomes. Contact any members of our research team. We are more than happy to help. Help us demonstrate the value of MDT to our patients, our employers, insurance companies, other physical therapists. If you are an MDT diplomat, please join us by participating. If you are not a diplomat, but you know some, please make them aware of this great opportunity.